Oh, okay, Sia. So you want to tell me about patients who want to masculinize their bodies, right?
Since I can only speak as a trans woman, let's speak to someone with first-hand experience.
Oh, hi, Sia. Is that another doctor's office? I guess that means you want me to talk about masculinizing treatment. So you do need to have knowledge of effective dosages, safe blood pressure ranges, and other factors. And the specifics of these can be found in publications like the WPATH guidelines.
I will definitely look it up.
The specific interventions you may use for trans men, however, are going to differ somewhat from trans women. The intervention may vary given the specific needs or desires of the patient. There is no one-size-fits-all solution.
The options that are available for transgender men are testosterone therapy. So that's when we put patient on maybe every second week or every month injections of testosterone while monitoring the increase of testosterone levels in the patient.
And I would usually start with the transdermal testosterone, which they take in through their skin, because we're not going to give too much of that. We just do a gradual increase of testosterone. So I'll start with a 5% cream, check it again in a month, then probably go up to a 10% cream. And when the person is really comfortable with the amount of testosterone they have, we will go over to injections. And there are two options for injections in South Africa: the depot testosterone, which we will inject around 1 milliliter every week, or then the libido, which we will inject now 6 weeks later, and after that every 10 to 12 weeks. It's more expensive, but it is more convenient, and it has a more stable profile as opposed to depot testosterone that makes peaks and troughs. And then we can also do implants. We are making pellets now in South Africa, which we can implant into the bum, and that also works quite nicely to keep the testosterone levels stable.
And because testosterone is such a potent hormone in and of itself, it would be generally administered on its own. No additional intervention is necessary to block estrogen.
Generally, the effects are pretty much what you'd expect, but the specific ways that HRT reacts with the body will differ between each individual.
I think it's very important to remind patients that every individual responds differently to hormonal therapy. The same dose that patient A is on might be too low or too high for patient B, and there's really no way to predict that. And we have to remember that each body is different on a molecular and cellular level. Those responses to hormones differ greatly from individual to individual, and they often take a long time to develop. Hormones are very powerful, but they work very slowly. So it's important to remind patients to be, ironically, patient and not to expect results overnight.
If a trans man would start on testosterone, there would be several changes that would happen, but the changes take time. So within 3 to 6 months, a trans man can expect some beard to start developing, and there will be a change in the voice, and then there will also be the male pattern baldness their hairline will start receding.
Those effects are irreversible. The reversible effects of testosterone include the increase in muscle mass and muscle density, changes in body fat distribution to a pattern more commonly associated with secondary sexual characteristics of cisgender men, the development of acne, the thickening of body hair, and a change in its distribution.
Some people, when you put them on the testosterone, in a month or two already, they stop going on their periods. So for some patients that struggle to stop going on their periods, we also add a depot progesterone that helps to stop the monthly bleeding.
And they can also not be as fertile as before. So if a trans man wants to consider having children one day from their own, it might be a good idea to save over before they start on hormones.
We also monitor your cholesterol especially, and your kidney functions, and sometimes we also monitor your electrolytes, because there could be also imbalance of the electrolytes, especially if you start adding diuretics.
And then what you will expect from an emotional side is maybe a little bit more aggression, an increase in the libido, maybe some irritability. But I must say, in my experience, when you give a person the hormones that is cis with their gender experience, they feel much better.
Anything we prescribe has side effects. We just need to be aware of the side effects and monitor where we can and reduce the risks where we can. But giving somebody gender-affirming hormones can be life-saving.
Testosterone is a powerful chemical when handled by professionals. The results, though, have a huge positive impact on the mental well-being and quality of life for trans people. Though I should probably mention binding.
Binding is flattening of the breast tissue, so that it does not show that, there is like a breast tissue in the trans men. And the risks mainly are also related to the type of strapping that is used. Some people would use really adhesive tape, which can be very constrictive and lead to breathing problems. There have been cases of rib fractures, if a lot of force, or there's, it's just too tight, so there's breathing fractures, there's bruising as well that can happen.
So binding is a non-surgical way of flattening the chest with what is essentially a special kind of vest. But as with everything, it can be risky.
It is very advisable that you give the breast a few hours a day to just be free and breathe out a bit, to just allow the blood flow also to happen and reduce the constriction.
Top surgery is a relatively straightforward procedure, but can be costly and time-consuming for men who don't have the access to proper health care.
It's difficult in South Africa to access gender-affirming care, and it's even a lot more difficult if you happen to be poor. So we know in South Africa only less than 20% of people are able to access medical aids, and medical aids don't always pay for gender-affirming care. A lot of people depend on the public sector, and access in the public sector is extremely limited. In the private sector, there is better access, but there's still a lot of ignorance and a lot of doctors who don't understand what it means to provide gender-affirming healthcare. Standards of Care 7 recommends that people are on hormones for some time before they have gender-affirming surgery, and the guidelines are different for top surgery and bottom surgery. So for genital surgery, generally the recommendation is that somebody is on hormones for at least a year before they have genital surgery. For top surgery, it's different. So if a trans man wants to have their breasts removed, they could have a mastectomy even without being on hormones.
So between that and what Sia has taught you, I'm sure you've got a solid grasp on how to best serve your transgender patients. Just remember though that every patient is unique and that there is always more to learn.
So, how are you feeling about all this?
Good. Actually, very, very good.